This is the Collaborative Stage Data Collection System CS Moments. The topic for today is bladder extension when there's no muscle in the specimen. And I'm Donna Gress, JCC Technical Specialist. Now the question is, what is the correct extension code for a bladder biopsy that is stated to contain no muscle fragments in the specimen? We're going to address the correct extension codes for bladder extension when there is no muscle found in that specimen. Now the first scenario is a patient with persistent hematuria who presents for a cystoscopy. The pathology report revealed papillary urothelial carcinoma with invasion of the lamina propria, no muscle fragments seen. What is the correct CS extension code? Well, the pathology report in this scenario seems pretty straightforward. The pathology report clearly states the lamina propria is invaded, which is most accurately reflected in CS extension code 155. Let's look at the next scenario. This patient again has persistent hematuria and presents for cystoscopy. The pathology reveals non-invasive papillary urothelial carcinoma, no muscle fragments seen. So what is the correct extension code? In this scenario, there is a definitive statement of non-invasion. So the pathology report provides a clear statement of non-invasion, which is CS extension code 010. Now our next scenario. The patient has persistent hematuria and presents for the cystoscopy. The pathology reveals urothelial carcinoma not otherwise specified, no muscle present. So what is the correct extension code? In this scenario, things become a little more challenging in selecting the correct extension code. There's no muscle in the specimen and there is no statement of invasion. You must refer to the instructions in CS extension in the bladder schema. Because the histology is not papillary, refer to Note 3. Note 2b also refers you to Note 3 for this scenario. Note 3 states if the distinction between involvement of the epithelium and lamina propria cannot be made, the tumor should be coded as confined to the mucosa not otherwise specified, code 100. Note 3 also includes the description, superficial, not otherwise specified. Because there is no muscle present in the specimen and no statement of lamina propria invasion, this biopsy clearly represents a superficial specimen only. Now the next scenario, again we have hematuria with a cystoscopy. The pathology reveals papillary transitional cell CA not otherwise specified. No muscle present. Microscopic description does not mention invasion. So what is the correct extension code? This final scenario again provides a challenge in selecting the correct extension code, as again there is no muscle in the specimen and no statement of invasion. For this scenario, refer to CS extension instructions in the bladder schema. Note 2b indicates that a microscopic description with no statement of invasion is considered as an inferred definition of non-invasion. Note that this applies for papillary histologies only. So the code would be 030. Now you can look for more information in the CS version 0204 and 0205 coding instructions. You can also look at the bladder schema and the CS extension instructions available. Be sure and submit your questions to the collaborative stage part of the Cancer Forum. This provides not only an answer for you, but information for everyone. It also allows us to track for educational purposes the frequency of questions and choose the next topic for some of these videos. Also, please check out the JCC YouTube channel. These are short videos on important concepts on both JCC and Collaborative Stage. Now, the Collaborative Stage videos are also posted on the Collaborative Stage webpage to make it easy for you to access them. This has been sponsored by the Collaborative Stage Version 2 Education and Training Team and AJCC, the administrative sponsor of Collaborative Stage. Thank you.